Mr. Speaker, I yield myself such time as I may consume.
The gentleman is recognized for as much time as he may consume.
Mr. Speaker, in the days leading up to Christmas, hackers stole millions of credit card numbers from the servers of retail giant Target. I imagine that at least a few here in this chamber may have had their own credit cards replaced to prevent theft. What if Target had not bothered to tell anyone? What if they had waited until people noticed fraudulent charges popping up on their statements? The damage would certainly be worse. It may shock some people to learn that there is no legal requirement that the Department of Health and Human Services notify an individual if his or her personal information is breached or improperly accessed through the Affordable Care Act's exchanges. While HHS has said that it will notify individuals in such a case, the American people have a right to know that their government is required by law to contact them if their personal information is compromised. H.R. 3811, the Health Exchange Security and Transparency Act, would simply ensure Americans receive notification from HHS when their personally identifiable information has been compromised through the exchanges. Specifically, the bill requires HHS to notify individuals no later than 2 business days after discovery of a breach of an exchange system. Since the disastrous rollout of the healthcare.gov website, congressional oversight has uncovered that end-to-end security testing of healthcare.gov did not occur before the October 1st launch, and that high-ranking administration officials were told of the security risk before the website went live. Teresa Fryer, the Chief Information Security Officer for the agency running the exchange system, even stated in a draft memo that the federal exchange, quote, does not reasonably meet security requirements, and there is also no confidence that personal identifiable information will be protected, end quote. A recent article in Information Week discussed a report released by Experian entitled 2014 Data Breach Industry Forecast, which stated that, quote, the healthcare industry by far will be the most susceptible to publicly disclosed and widely scrutinized data breaches in 2014. According to Information Week, the author of the study said he is basing this prediction at least partly on reports of security risk posted by the healthcare.gov website and the health insurance exchanges established by various states. The web infrastructure to support health insurance reform was, quote, put together too quickly and haphazardly, end quote. The most glaring problem for these sites has been their inability to keep up with consumer demand. The organizational infrastructure behind the implementation of Obamacare is also complex, meaning that many parties have access to the personal data and could misuse or mishandle it. Quote, so we have volume issues, security issues, multiple data handling points, all generally not good things for protecting protected health information and personal identity information, end quote. Given the lack of security testing and the risk associated with healthcare.gov and the administration's repeated misrepresentation of the website's readiness and functionality, H.R. 3811 is a reasonable step to ensure federal officials are required to notify individuals in case of a breach. Thank you, and I reserve the balance of my time.
The gentleman from Florida is recognized for 4 minutes.
Thank you, Mr. Speaker. Thank you, Mr. Chairman. I appreciate it very much. Mr. Speaker, I rise today in support of the Health Exchange Security and Transparency Act. I'm pleased to be an original co-sponsor of this legislation, and I'm glad we're addressing this very important issue on the House floor today. Each day I hear from constituents in Florida's 12th congressional district who are experiencing the negative impacts of Obamacare. Contrary to the very promises the law was sold on, my constituents have lost their health care coverage, have seen their premiums rise, and were forced to choose new doctors. Now they're faced with concerns regarding their personal information and whether it is compromised, all because the President's signature law was never really ready for prime time. The Energy and Commerce Committee, which I'm a member of, has held numerous hearings into the failed website and the lack of testing that occurred to ensure the website was properly secured. In these hearings, we have learned that 30 to 40% of the website isn't built. End-to-end security testing wasn't performed. CMS's own Chief Security Information Officer recommended against an authority to operate because of cybersecurity concerns. Her memo even stated there is no confidence that personal identifiable information will be protected. And it was the administrator of CMS, not the Chief Information Officer, that signed off on the ATO. Mr. Speaker, does this sound like a safe and secure website? Millions of Americans were forced to sign up for the exchanges in order to avoid individual mandate fines. And now each of these individuals, including myself and many in this chamber, are potential victims of identity theft. While privacy in the healthcare realm is typically protected by HIPAA, it does not apply to HHS or the federally run exchanges. Furthermore, data notification is critical to maintaining security, and individuals should be notified when their personal information could be compromised. Yet in the final rules HHS published in August, it did not finalize a data breach notification rule. Instead, it stated that it is up to CMS to determine whether a risk of harm exists and if individuals need to be notified. A government bureaucrat, Mr. Speaker, should not be given the power to determine whether the loss of personally identifiable information constitutes harm. We do not know how many breaches have occurred on healthcare.gov, whether due to the accidental sharing of information or otherwise, because there is currently no public disclosure requirement. The Health Exchange Security and Transparency Act will bring accountability and transparency to the administration and the healthcare exchanges. I strongly urge my colleagues in the House to support this bill today, and I urge all, of course, our colleagues in the Senate to swiftly take up this bill so that we may pass it into law. I thank you, Mr. Speaker, and I yield back to you.
The gentleman from Michigan is recognized for 3 minutes.
Well, thank you, Mr. Speaker. I rise in strong support of this legislation, H.R. 3811, the Health Exchange Security and Transparency Act of 2014. Security and transparency, both are critically important to every American, and the public expects and deserves to have them both when it comes to health care. Sadly, I believe the administration has failed to deliver. This important bill seeks to provide peace of mind to folks in Michigan and across the country who have submitted personal information to a federal health insurance exchange. Americans have the right to know in the event that their sensitive personal information provided to an exchange is compromised, especially as it is the law's individual mandate that forces them to purchase the government-approved health care coverage. Why wouldn't we want the public to know and be alerted right away? Just this morning on CNBC, breaking news, CEO of Target apparently is indicating that as many as 70 million Americans, their customers, may have had their private information stolen. Would it have been right for Target just to sit on that information? Or was it appropriate for them to try and put the word out so that they at least, the consumers have the right information? Let me tell you what this bill does. It's a common sense bill. It's going to require that the administration promptly inform individuals within 2 business days if their personal information has been stolen or unlawfully accessed through an exchange. And through the Energy and Commerce Committee's thoughtful oversight, we have uncovered troubling information regarding the security of the health laws exchanges. So what this bill does, it's preventive medicine. Do we want to wait until the horse is out of the barn before we take action? I don't think so. We found that the administration did not perform a full security control assessment before healthcare.gov opened for business on October 1st. We've also learned that just days before healthcare.gov went live, senior officials at HHS expressed serious concerns regarding the protection of personally identifiable information that was entered into their website. These facts, on top of the fact that the administration has repeatedly misrepresented the functionality and the readiness of the healthcare law, raise significant questions regarding the security of healthcare.gov and the information available in the exchanges. A few weeks ago, the administration was willing to let millions of Americans lose their health insurance, despite the president's solemn promise that they could keep their health plan if they liked it. And it took the House, acting in a bipartisan legislative manner, for the administration to confess that, yes, it had broken their promise. Now the administration is saying it opposes this requirement, that it notify Americans when personal information is stolen. The self-proclaimed most transparent... Could I have an additional 30 seconds?
Yield an additional 30 seconds.
The gentleman is recognized for an additional 30 seconds.
So the self-proclaimed most transparent administration in history has come out against transparency. I'm sorry. Republicans and Democrats may disagree on the merits of the president's health care law, and we do. But I think that we should all agree that Americans deserve to be notified if that personal information is put at risk by the law. I want to thank Chairman Pitts for putting security and transparency above politics, and I would urge my colleagues in a bipartisan way to support this bill this morning. I yield back the balance of my time.
Gentleman's time has expired.
Speaker, when is this administration finally going to start paying attention to the warning signs? When career staff at OMB warned the administration that Solyndra wasn't ready for prime time, they moved forward anyway and lost hardworking taxpayers $500 million when private consultants told the White House and HHS officials last spring that there were problems with healthcare.gov. They moved forward anyway, and when CMS sent a memo just 4 days before healthcare.gov went live and warned about inherent security risk, their terminology, the administration moved forward anyway. So their failed policy of forward is costing us money and is getting people into trouble. So this is what we're hearing from an Experian report. America's personal information is at high risk on healthcare.gov. There is a great opportunity for data breach. This is something we can stop. The bill today does that. It is simple. It addresses the problem. What it does very simply, and I commend the gentleman from Pennsylvania for the Health Exchange Security and Transparency Act. It accomplishes what this administration has failed to do and to make a standard practice. It will force HHS to inform anyone if their information has been breached, and they have to do this within 2 business days. They can't hide it. They can't spin it. They've got to tell you if your information has been breached. We do this because if the administration is going to require us, and yes, to my colleagues, it is a requirement to use healthcare.gov, at least they can notify you when your information has been breached.
Thanks to gentleman from Pennsylvania for yielding and for bringing the Health Exchange Security and Transparency Act. And Mr. Speaker, all we're saying here is if American families' personal information is stolen through this website, through the Exchange website, they ought to be notified by the administration that their data was breached. And of course, you've got the White House actually coming out and saying that they would veto this bill. What does the Obama administration have against protecting the privacy of American families' personal information? You've got administration officials that testified before our committees. Chief Information Security Officer actually said there is also no confidence that personal identifiable information will be protected. Well, if they can't assure the protection, and by the way, the individual mandate says this is not an option for American families, they have to go through this exchange to get insurance that's approved by the government. So if the government's going to mandate it, we don't want the government to mandate that they have to go do this, but the government is mandating it, and if they're going to mandate it, they ought to at least be able to ensure that their data is protected, and if it's breached, they ought to notify them that this has happened, and yet they'd issue a veto threat against this. We need to pass this legislation, put this transparency in law, pass this bill. I yield back the balance.
Gentlemen.
I thank the Speaker and I thank the Chairman of the committee for his good work, and I would remind our colleagues that when you call the 800 number to sign up for the exchange policies, as was heard before our committee in testimony, the people who get that number on that phone call then turn around and use the healthcare.gov site, the information, the website, to input that information. So you are forced to go through this site. You know, a couple of weeks ago I received this letter. We are writing to you because an electronic file containing your personal information cannot be accounted for. The file included 2 or more of the following: your name, home mailing address, and social security number. The letter went on to say, we wanted to alert you to the potential that someone not authorized to access the records could have seen this information. This letter came from the state of Colorado. This letter from the state of Colorado because they couldn't hold on to state employees' private, personal identification information. All we're asking for is that we protect the privacy, the security of the American people. To oppose this bill, to issue a veto threat, if the site is secure, they'll never receive the notice. If it's not, we will have acted to protect the American people. With that, Mr. Chairman,
Mr. Speaker, some have argued that requiring HHS to report a data breach that is known to have resulted in a loss of personal identifiable information within 2 days is too burdensome for the department. In fact, the administration opposes this legislation for, quote, paperwork requirements, end quote. I'm frankly shocked that any member of this body would put workload concerns of HHS ahead of their constituents' right to know if their data has been breached, when many of our constituents are essentially being forced to shop through these exchanges. In addition, CMS has stated that states and other non-exchange entities are required to report data breaches to the department within 1 hour to HHS. If HHS believes 1 hour is enough time to report, then they should certainly be able to tell our constituents within 2 days after knowing an individual's information was breached through an exchange. Our constituents deserve to know if their personal information has been breached. That is all the underlying bill requires. Our constituents have a right to know. They should have peace of mind, and we should be protecting them, the victims, not the bureaucracy. I urge my colleagues to support this common sense, important bill, and yield back the balance of my time.
On this vote, the yeas are 291, the nays are 122. The bill is passed without